I wanted to talk a little bit about methadone clinics and try to get some people some information. If you're out there looking for help to get off of opiates, some of you are looking for help to get off of heroin. If you're looking into methadone treatment, I recommend, you're gonna want to weigh your options, because you're trading something for something else. But the goal is to try to get onto something that isn't as dangerous and isn't messing your life and your world up. So the thing about methadone clinics is they are there to help you. If you're honest with them and you do want to get clean and you do want to start a whole new lifestyle, yeah, go for it. They can help you with SUBOXONE or methadone. The thing is, they don't care if you don't have money to pay. If you don't have money to pay, you're gonna miss a dose. They don't care. There's nothing they can really help you with that. Another thing is they give you minimal. They're gonna give you, like methadone, they're gonna give you minimal. Like, it's just enough to like stop the withdrawals. It's enough to you can kind of start to focus a little bit. The goal is to, block your receptor, and then you can just be productive and go live. It's not going to mess you up. It's not going to really take you, it's not going to really be like it when you were self-medicating and you dosed maybe 2 or 3 times a day. You use 2 or 3 times a day. So for me, I would usually have a pill in the morning, and then I need another dose in the afternoon, 3, 4 p.m. When I was self-medicating, I would need something else in the middle of the day. What they do, you go in once in the morning, you dose, and that's it. So you take your dose one time in the morning. Sometimes you can get split doses where you have, 1 in the morning, 1 in the afternoon. Again, you have to jump through some hoops with that. And they're really going to give you minimal, so you can just kind of enough to take away your withdrawals, and you can work or be productive or whatever. But with that comes irritability, a little bit of anxiety, and maybe some sleep issues and stuff like that. Yeah, and if you just build a system, you can really work it, and you can become successful. But you're going to have to go there every morning usually, unless your drug tests are clean all the time. I use medical marijuana in the evenings. So when I was doing the methadone, I would smoke in the evenings, and it would help me. It would help with the methadone side effects, and it would help me kind of calm down. It would help my nausea. It would help my anxiety. It would help me eat. It would help me get an appetite, help me calm down, help me relax, focus, sleep, things like that. But yeah, they really do give you minimal just to get by, and don't mix anything on it, just kind of commit and use it as a time to maintenance, just take what they're giving you, use the system, work the system, and stack up some time without the other stuff you were using. If it's heroin, get yourself time, stack and focus on building time without using. Focus on the first day, then the first 3 days, then the first week, the first month, and just all that time you're just going to be coming back, and all that pain. Realize it's you coming back. It's a new you coming. And let go of the old you and the old habits and make room for the new you. It's about looking in the mirror and finally saying, I'm sick and tired of being a drug addict. I'm sick and tired of not having anything. Sick and tired of not being intelligent and educated. Sick and tired of not being able to save money. Not being able to have a clean environment and a safe environment, not being able to hold down a job, because every day you have to find your fucking fix, and you have to feel okay, and Make sure you're not going to withdraw or get sick. You have to make sure you're not going to go start withdrawing and get anxiety attacks and panic attacks and then start getting violent and unpleasant at work. The methadone's going to help you because, boom, you got it in your system. You're not going to be craving all day and you're not going to be withdrawing. So you can focus and work and be productive. Get your life back. Start building your life back. Start building a new foundation without heroin or without the pills you're doing. But so yeah, methadone and SUBOXONE can work, and it is addictive. Of course, it's an opiate, but that's the thing. A lot of people are gonna say, "Oh, well, you're just trading that for that, or you're just getting a new habit." But it's maintenancing, okay? So you're just focusing on using this medication assistance. You're using something to get rid of the dangerous thing that you're self-medicating with that's ruining you and your life. So you use this other system to maintenance and get stack time without A. Use B. You know what I mean? And get rid of the A problem. And medication assistance, use the medication. And, yeah, whether it's KRATOM, methadone, or SUBOXONE, and, like I said, use minimal. Of course, the first 3 days to a week, you're going to need a lot more medication assistance. But then when you get out of that week, start cutting down and cutting your doses in half or by 10%. Reduce 10% every week. That's a very good way to go about it. But like I said, KRATOM is the way to go. Exercising, diet, and just learning and educating yourself, reading. It's just going to create new connections in your brain, and your brain's going to come back. You're going to start building new pathways, neural pathways, and firing in new places and making new connections in your mind. And that's going to help your brain recover, And exercising is just going to be amazing for you and kick out all those chemicals, kick out all those toxins, all that pain and all that sweat is all of that. It's all the old you leaving. And, let go of the old you to make room for the new you, the new, better, improved you that cares about living a good, clean life. Think of these in levels. You're going up a level. Every couple months, you're just going up a level and you're improving your quality of life. That's the goal here. To not live in that painful, uncertain, shady, depressed, dark dimension of being an addict. This is when you look in the mirror, like I said, and you say, I'm sick and tired of being a drug addict. I'm sick and tired of wasting my life and not having a good life. I deserve a good life. I deserve a peaceful, joyful life. So let go of the things that are holding you back and keeping you from developing into a better you. At the end of the day, it's all up to you, no doctor. And, these doctors and psychologists and these people can help you. They can help you and they can point you in the right direction or give you some advice on what to focus on and what to give your attention to. But at the end of the day, it's you being able to stand up tall and take control of your life and admit all the pain and suffering and problems in your life is your fault. Take responsibility for it and fix it and start building a new life. We're alive, and when you're alive, where there's life, there's hope. You can evolve. You can take today and evolve and take your life. Finally take control of your life, responsibility for your life. You don't want to die on some stranger's couch, covered in cigarette ash and cigarette burns with beer cans all around you and needles everywhere. You don't want to do that to yourself. So start the climb out of the darkness. And like I said, methadone and SUBOXONE, it can help you, But I highly recommend going the natural route, and KRATOM can definitely be that cure and that path to take. I have a lot of videos on KRATOM, and there's a lot of information out there on KRATOM. KRATOM exercising, having a friend or two to go to and talk to, and go to meetings, maybe NA, AA, whatever the case. I have found a way where I don't have to go to those meetings. I'm fine. I have a system that works. And yeah, I hope this helps somebody and anybody. Like I said, weigh your options. Methadone clinics can help you, but if you really do commit to it, it can also help you get up early and start to have a schedule and have some kind of a schedule and a regimen and habits. You can create new habits every day. You know, okay, every day I'm gonna walk to my clinic and get exercise. Every day I'm gonna ride my bike to the clinic and get exercise. You know, it can help you evolve into a morning person. It can help you evolve into a productive person too. But like I said, it's minimal and it can get you by. I recommend not being on the clinic, the methadone and SUBOXONE, for more than like a year. I know a lot of people that get on it for 2, 3, 5, 10 years, and you deal with some pretty violent people. You deal with some pretty uneducated people, but you know, at these clinics there's a lot of hostility and edginess and confusion and a lot going on there, a lot of bad attitudes there. But it's worth it, man. If you're looking for a way out of the darkness, if you're just doing pills and you know, taking them orally, I suggest getting into KRATOM. If you're doing heroin or maybe shooting up pills or something really intense, I would go and talk to somebody at a clinic, a methadone or SUBOXONE, and see what you can do to take that first step. And like I said, make sure you have a plan. Don't get on it for 8 years. You know, maybe get on it for half a year, maybe 6 months, 3 months, but have a plan. And don't be on the methadone program forever. But work it. If you work it, it'll work for you. Yeah, I love you lots. I thank you so much. I hope this helps somebody. There's a better life for you at the end of all of this. You have to focus and push through the darkness and build a life with a better quality. Have faith in yourself and believe in yourself. I love you.